As a psychiatrist, I have appreciation for the beneficial effect of medication in treating certain conditions and symptoms. In my opinion, the most commonly prescribed antidepressant or anxiolytic anti-anxiety medicine in our country is the SSRI or the SNRIs. They're medicines that were believed initially to be effective because they inhibit the reuptake of serotonin. The SSRI stands for serotonin-specific reuptake inhibitor. The medicines are wonderful because they actually provide relief. If you're having panic attacks, you can start on a small dose of Zoloft, for instance, and get almost immediate relief for many people. They also are very helpful for depression. They have a very calming effect, and they help restore a sense of hope to people. Of course, they can cause untoward side effects even in the beginning, especially with adolescents, and can cause suicidal thoughts, where in most cases they reduce those thoughts. So they can be really powerfully effective and good in that way. They also have an interesting effect deep in the core of the brain in enhancing the growth or production of new brain cells. Now that's really good, and we think that now that is part of why they exert an antidepressant effect, is the actual promotion of those new brain cells that you can activate to enhance your learning skills and your mood. Those cells deep in the core of the brain are in the area of the brain where we feel emotion, and so it may be that that's part of why it helps to lift one's spirits. It also may be that being on an SSRI with that enhanced neurogenesis or new brain cells could limit your tendency toward dementia in later life. We still have a lot of questions to answer in that regard. At the same time that there are good effects from the SSRIs, there are some profoundly negative or adverse effects, especially over time. Many of them will cause weight gain in a big percentage of people who take them. Weight gain usually does not occur right away. In fact, in some cases, like with Prozac, there may be initial weight loss. But over time, people tend to put on weight when they take an SSRI. Maybe it's just 5 pounds. For some people, it could be 40 pounds, particularly with the calming agents like Paxil. The paroxetine is the generic. The weight gain can be substantial, and that's a problem for most of us. For people who are underweight, of course, not a big issue, might actually be helpful, especially if the person stops eating when they're depressed. That said, weight gain for many people is a nasty side effect. Second effect that I worry about with people on SSRIs is sexual dysfunction. Many people who take them experience a decline in their sex drive, but more importantly, there is a prolongation of the time to be able to achieve orgasm or climax, and sometimes it's prolonged to the point that it's virtually impossible to get there when you're on an SSRI. This can be hugely problematic for men and for women, and is one of the reasons why many people will choose to get off an SSRI over time. A third effect that I've noticed is some degree of emotional blunting or feeling of disconnection from healthy anxiety. One woman told me that while she was very obsessive about cleaning the kitchen before she got sick and had an increase in depression and anxiety, once she got on an SSRI, she could be sitting on the couch, notice a messy kitchen, and think, oh well, doesn't bother me. Which to her mind was a decided negative effect of being on the SSRIs, that they, for her, produced a decline in her sense of urgency or motivation to do the things that were presented to her. So those three things are three reasons why some people will get off of SSRIs, and three reasons why I prefer to avoid them. Obviously, every brain is unique, and side effects which are very prominent in one person may not occur at all in others. So if you're looking for more information, I'll be posting more videos about other medication options and about how to get off SSRIs if you so desire.